Thanks for joining us. I'm James Faulk. This is a special live edition of North Coast Perspectives. In an effort to bring you the most current tallies and information from the COVID-19 pandemic, KEAT TV will offer a live weekly newscast for the first time in its history. We're excited by the opportunity to provide an additional service to our members and viewers, yet the precarious nature of this moment calls for a greater commitment from everyone. We simply hope to do our part. As of today, Humboldt County has 50 cases of COVID-19 within its borders, a number that is held for the past several days, with 3 hospitalized. The state of California, meanwhile, has surpassed 20,000 cases, a figure many consider to be a positive outgrowth of early and decisive state action to shelter in place. Nationally, the figures are just shy of 500,000. Yet new hospital admission numbers around the country indicate that the infamous curve of COVID cases may be flattening, but for Humboldt County, we've yet to hit our peak. To be clear, we're still in the heart of this pandemic. Every move we make now helps determine our collective future. Over the 24-hour period between Wednesday and Thursday this week, an American died of the coronavirus once every 47 minutes. It's already become the single most common daily killer in the country, surpassing cancer and heart disease for that dark distinction. Experts say it will take unprecedented levels of patience and cooperation for this community to survive and thrive in the face of these challenges. Even in isolation, we are not alone. Now, the headlines. As our community and the nation in general fight to stop the spread of coronavirus, city leaders took steps this week to explore how best to protect one of Eureka's most vulnerable populations, the homeless. At the City Council meeting this week, police officials described the efforts undertaken by the Community Safety Engagement Team, or CSET, to address this challenge. These efforts include keeping the St. Vincent de Paul Dining Center in Old Town open. City officials have closed 3rd Street in front of the dining center and added a hand washing center to help fight the virus. They've also partnered with homeless advocate Betty Chin to help address her needs, as well as those as Food for People and other groups. One of Humboldt County's major employers has been forced by the COVID-19 pandemic to furlough many of its workers. According to a press release from Mad River Community Hospital, since the inception of Humboldt County's shelter-in-place order, Mad River has experienced between 40% and 70% decreases in its emergency department, medical surgical department, imaging, laboratory, outpatient clinics, and administrative support services. While the length of the furlough and pandemic are unknown, hospital officials have said their intention is to bring back impacted employees when patient volumes return to normal. The North Coast's 2 colleges are falling further into the red financially as a result of the coronavirus. At meetings this week, both institutions reported that they will be facing enormous budget challenges this year due to COVID. According to the Lost Coast Outpost, CR was already facing a $1.3 million budget reduction due to declines in state funding. Now the college is bracing for more state cuts, as well as a shortfall from dormitory vacancies and a decline in food services. HSU had anticipated a serious budget shortfall prior to the coronavirus. That expected $5.4 million gap is now likely to become a $20 million shortfall over 2 years. Presidents at both CR and HSU say that difficult choices are ahead, but they both also indicated that in spite of these challenges, they believe their institutions have a strong future in Humboldt County. St. Joseph Hospital this week announced that it will participate in 2 national trials of the antiviral drug remdesivir to determine its worth in fighting moderate and severe cases of COVID-19. According to a press release from St. Joseph Hospital, the experimental drug has shown promise. St. Joe's is the only hospital within St. Joseph Health System of Northern California to open as a site for these clinical trials. The hospital was chosen due to an established relationship with the principal investigator of the trial and because its leadership was proactive in seeking accelerated approval for these trials. Humboldt County and much of the rest of this region of Northern California are at risk of being undercounted in the 2020 census, again due to the ongoing COVID crisis. The story, reported this week by Lost Coast Outpost, indicates some local people are starting to raise concerns that any undercount could effectively hamper Humboldt County far into the future. Schools and healthcare systems could be underfunded. Disaster relief programs could shrink. Federal and state grants may be diminished, and the county's political clout could be reduced. According to the Outpost, a few weeks ago throughout the United States, letters from the Census Bureau started showing up at homes with regular street addresses. The early results from that effort are in, with Humboldt and other North Coast counties lagging far behind the state and the nation. The main defense communities have in this existential battle we're fighting against COVID-19 are the brilliant and talented public health officials who've guided our response and worked to keep us all healthy. Humboldt County.
Today we ran 55 specimens. So, we consider that pretty much at our capacity on most days' runs. So I can tell you, because we've identified community transmission cases, that we do have COVID circulating in our community. At this point, it may be in relatively low levels, and that's been helped by the fact that we have had shelter in place, and because people are social distancing and limiting their movements outside their own home, as well as decreasing their interactions with people who live outside their home. So we are constantly in a position of working to acquire more kits because we're using them on an ongoing basis, obviously. And so we've been adjusting those numbers just to show people that, our current supplies go down as we do this testing. And then we will tweak that back up when we get additional supplies in the door. So right now I think we just got some additional things in the last day. So every bit that we get in helps. And again, we are still pursuing reagents for some of the other equipment we have on site that would help us increase our testing capacity. And, we voiced those concerns to the state as well as our representatives and such too, because a loosening in that supply chain would help us a great deal.
People are recovering, though Frankovich said the changeable definition of what recovery means has kept those lists short, but only for the time being.
Part of the problem here is that as you look from county to county or even across the country, even on the Hopkins site, the Worldometer site that a lot of people look at for this, this recovery column is really hard to interpret. And it's because there hasn't been a really universal definition of what that means. Does that mean when someone is completely free of symptoms after COVID? Does that mean that they're a certain number of days out from COVID? Does it mean that they've been removed from isolation? And that's the definition. So we've actually been asking for guidance along with a lot of other areas from state public health and such to sort of have a uniform definition for that so that we can all report in the same way and it becomes much more meaningful to look from area to area about outcomes.
Frankovich was asked about the recent opening of Chipotle in Eureka and whether those resulting crowds presented a health risk.
So I think the order is very specific about restaurants and what they should be doing, and certainly language in there about doing social distancing to the maximum extent possible. And we expect that because it ultimately is a safety issue for all of our restaurants. And so I think in general, our approach has been educational rather than punitive in these instances, but there certainly are enforcement options for entities that are not adhering to the policies and orders that we have put in place.
Finally, managing editor Mark Vales of the Times-Standard asked how county officials could be certain we haven't hit our local surge in cases without proper statistical modeling.
The term we use for surge essentially refers to sort of that fast increase in number of cases that brings us to a peak. And again, when we talk about preparing for surge, we're talking about that rapid influx of cases that may challenge our capacity at the local level to provide care. So surge, I can tell you that we have not hit surge because in relative terms, and when you look at New York and San Francisco and other areas of the country, and even in smaller rural areas, we have not hit the kind of caseload that we would term surge. And I can only say that when we hit that steep incline of cases, we'll all know that. And we'll certainly be communicating about that when it appears to be really upon us or we're seeing that trend. Modeling is helpful in terms of planning purposes right out of the gate to try and say, how is this likely to unfold? When is it likely to occur? How many people are we talking about? How do we actually determine how many more beds and ventilators and all those things we need? There are multiple formulas to do this, and all I can tell you is that when you're first starting with something like this, there's not a whole lot of meaning to these models because there are so many points that you have to insert of subjective data into the model that you do not have even good guesses on, that the model itself does not really provide a lot of assistance, certainly to the public, in terms of planning and understanding how this is going to unfold. My understanding is that the state is working on modeling for counties as well, and I'm hoping to see that soon. We have not yet received that. And what will be helpful about that is they will be basing that, I assume, on the experience that we're seeing in California. And so it will be timely, and it will reflect what we've been seeing in very recent days with this, in recent weeks. And I think it will give us a little more solid footing about planning as we go forward.
We'll be back after this short message from KEAT Executive Director David Gordon.
I'm David Gordon, KEAT's Executive Director, and I know you're just as concerned about your family and friends as we all are here at KEAT. Life is anything but normal. This is exactly the reason why the Frontline team is working to make sure you have access to the full information about this life-altering pandemic by producing a documentary on the government's response to the outbreak that airs on April 21st. And I'll be watching right along with you. This crucial work takes real funding, from added children's programming resources while our kids are out of school to vital daily reporting from PBS NewsHour. These times demand that we all do our part, so please, support KEAT right now. Your continued partnership is essential for the work that lies ahead. Stay safe and stay tuned.
Thanks for watching. I'm James Faulk. As part of his bi-weekly COVID update, Humboldt County Sheriff William Hansel addressed several questions posed to him by various media outlets. First and foremost, Hansel answered the pivotal question of what local residents could do to protect themselves.
My guidance is going to be the same that we gave people before this whole thing happened. That is, protect yourself. Protect your home, make sure it's locked at all times, make sure that you have the appropriate lighting at nighttime. If you have security cameras, make sure those are operational. Cut, vegetation back from the house, make sure no one can hide in there. And also, don't let yourself be vulnerable or victimized by leaving stuff in your vehicle. So your vehicle should not have any valuables in it whatsoever. It just takes a minute for someone to break a window, steal a purse, steal some valuables out of the car, and they're off. And so do your part to try and mitigate those circumstances and really, really do those crime prevention techniques that we've been preaching for years. There are people that are still being arrested for property crimes, whether they be held in the jail or being cited. There is accountability with that. So we are still investigating those. If we find them, we will arrest them, and they will eventually have their day in court.
Hansel was also asked if the county was actively citing people for violations of the shelter-in-place directive put in place by state and local health officials.
So no citations have been issued yet. We've issued lots of warnings, and so we haven't had repeated warnings. That's when we get into those citations. So we log everyone's name that we end up giving warnings to. If we have repeat offenses, that's when we get into the citation aspect of things. So right now we have deputies responding. We have actually code enforcement officers for the county that are actually going out following up on complaints as well. But we're out there, and if we see people that are congregating together, we will stop, we will talk to them, and make sure that if it's people that are outside of someone's household, that we will discuss that with them, give them a warning. If we've warned them before, they might get a citation. So I think a lot of people drive by and they see like there's different parking lots that are near full, and so it causes some concern. I know there's some areas of beaches where people say there's multiple people hanging out in one location. So what we would like to do is we'll follow up on those complaints, and that we've actually gone out there and discussed those with people. We do have beat patrols that are out. They're irregular at times. They're patrolling different areas of the county, but we do have beach patrols. And so if we do come across those people, we will issue those warnings, but we just urge people, there's plenty of open space on the beach. Please separate yourselves. If you're going to go with your household, it's fine to all be together. If you're going there by yourself, please be by yourself. Don't, just because it's a beach, you can't have all your friends there. You can't have a party there. It's not something to do. So we urge people to continue that shelter in place and that social isolation, social distancing.
There has been much confusion locally and otherwise as to whether people are actively required to wear face masks when out of the house, as well as whether traditional outdoor forms of recreation were still available to local residents.
So right now, it's just a suggestion. It's highly recommended by the public health officer to wear a mask when you're out in public. And so we're following through with that recommendation. It is not an order for everyone to do so right now. But I mean, eventually it could be a very, very strict order that the public health officer puts on Humboldt County. It is part of our order to allow people to go out and visit parks. We understand we're in a rural area. We have access to parks. We have access to beaches. We have lots of trails out there. So we would love people to utilize those, but only when they can socially distance. They keep that 6-foot bubble around them at all times. We would love people just to access the areas that are closest to their house. But we also want people to spread out. So if you see that there's a trail that a lot of people are using, please go to another one. There's a lot of other places to go and to walk here in the county. There are certain trails within state parks and federal parks that are closed right now. So make sure you call ahead. Make sure you visit those websites to see what parks are open and closed right now. I understand that Fish and Wildlife their commission is weighing in on whether or not they should suspend hunting and also sport fishing coming on, this late spring, summer, and into the fall. So I am against that. I think you have to be able to, I think, gauge this type of regulation based upon the area in the state that it's dealing with. So we are rural Northern California. We have a lot of wide open space, we have the wild rivers, we have the ocean, we have our beaches and vast forests and open space. We have the ability to really socially distance while we're performing these activities. So I'm urging the Fish and Game Commission, do not, put a blanket statement out there canceling hunting and fishing for all these different areas. I think our local residents should be allowed to get their hunting permits. They should be allowed to fish and hunt here in rural Northern California. This is a lot of times this is generational. They're generational hunters. You need it for food. It is not just a sport. It is for food, as well as we have our Native American community that is cultural, and so don't deprive us of these opportunities to enjoy our county and to provide this sustenance for our families.
Eureka Mayor Susan Seaman, in an effort to stay in touch with her constituents and provide some comfort during the COVID crisis, today issued yet another missive from her office in City Hall. Among other issues, she directly addressed the importance of the U.S. Census in determining Eureka's future political and financial success.
Over the past few weeks, many of you have been asking what you can do to help. This is a disaster of great magnitude, and it's progressing in a way that makes people feel especially helpless. But there are some simple and incredibly important things we can all be doing. 1, you've heard it before, shelter in place. Don't go out unless you absolutely have to. While essential work may be required and occasionally a grocery store trip may be unavoidable, don't let yourself slip into complacency. Every trip outside your home and every interpersonal interaction outside your household dramatically increases the potential for this illness to spread. I'm sure you know by now that even if you aren't sick, you could be a carrier and unknowingly spread the illness. As the situation progresses and the challenges of staying in place become even more arduous, please continue to do so. You really are saving lives. But if you do go out, wear a mask. The latest CDC guidance recommends that each of us take steps to cover our face when we're forced to move around in public environments. Put aside your fears of looking silly, strap on the most effective mask you can access, even if it's just a bandana, and let's work together to do everything we can to limit the spread of COVID-19 in our community. And this next one is really big. It's important to our community. If you haven't done so yet, please take the 2020 census. It only takes a few minutes, and the response will impact funding and resources needed to support our local health clinics, fire departments, schools, and many other fundamental areas that support our quality of life. It's estimated that each person counted brings about $2,000 to the community, so every single person counts. In Humboldt County, many residents don't have direct mail delivery. Traditionally, census field workers would visit those households, as well as those who have not yet completed their census forms. Unfortunately, due to the COVID-19 shelter-in-place order, census fieldwork has been postponed. That makes participation more critical than ever. If Humboldt County isn't counted properly, we could face decreased funding for schools, health care, and state and federal grants that our community will need during recovery. So if you haven't completed the census form, please take a few minutes to tackle this today. You can take the census online at 2020census.gov or by calling 844-330-2020. If you want to track our community's engagement with the census, there's a cool visualization tool available online at publictableau.com. Finally, I wanted to provide an update related to how the city and county are supporting our community members that are experiencing homelessness. Humboldt County has received over $600,000 in state assistance that will be deployed in the direction of homeless services. This includes providing motel rooms for homeless community members who are being tested or test positive for COVID-19. Accordingly, the county has ramped up their efforts to provide COVID-19 screening during free meal for symptomatic community members. Additionally, some of the funding provided by the state will be used for more portable restrooms and hand washing stations to supplement those that have already been deployed to ensure safe access to restrooms for everyone in our community.
I'm James Faulk. In the midst of figuring out how to best survive and thrive in the age of the COVID pandemic, the Northern California Community Blood Bank is asking that people remember the importance of their mission and find time to give blood. Supplies at the moment are stable, yet with schools and colleges no longer in session, the blood bank has lost its largest sources of donor blood. Director John Golem told KEAT TV this week that transmission risks are minimized by the process they use to maintain social distancing and by the strict standards for cleanliness at their facilities.
We've had a tremendous response from the general public. We've been busy, and our inventory currently is in great shape. Our biggest issue is that we get up to 25% of our donations from HSU, CR, and the high schools, and they're closed. So we need to make up 25% of our collections over the next few months from other sources, either blood drives or folks coming into the blood center. There's no evidence that COVID is transmitted by transfusion. Currently, there's no reason to believe that it will. Generally, what we see when there's a crisis is an excellent turnout from the people of Humboldt County. What we've seen this time has been no different. We have an excellent inventory currently. Our dilemma is that all of the people who've donated in the next 2 weeks won't be eligible to donate again for another 8 weeks. And we'll still need blood a week from now, 2 weeks from now, 4 weeks from now. So the message we're trying to get out to folks is don't forget about us. We are here. We're working. We still have blood drives. People can check the website at nccbb.org for current blood drive schedules. We have needed to change some blood drives occasionally, so people should check back on the website before they go out to a blood drive just to be sure we're still there. Or give us a call at 443-8004 with any questions. Currently, we have instituted some social distancing policies. We're only allowing a certain number of people onto a bloodmobile or into the blood bank at a time. We're taking names and asking folks to maybe wait in their car or wait outside, and we'll come get them when there's space. We're also taking temperatures before folks come into the building, just to be sure nobody with a fever comes in. Mm-hmm. Typically, blood donors are healthy and know that they need to be healthy to come in and donate. We're taking temperatures just to be sure. We're asking folks not to come donate if they've traveled in the last 14 days out of the country or on a cruise ship. And if they've been a caregiver for anyone who does have COVID, that they wait 28 days before coming in. Once they're here, we're very good at keeping the facility clean, and we've redoubled those efforts. Every chair is being wiped down between donors. Our electronic tablets that are used for our questionnaire are cleaned with alcohol between each donor. We have folks 6 feet apart in the welcome center as they're doing their questionnaire. Again, we're limiting the number of people in any given place so that we can maintain that distancing. One of our biggest issues, again, will be that as people are sheltering in place, they're not out in the community. So if folks are out in the community because they have something essential to do, if they're out grocery shopping and they're healthy, we ask them to swing by the blood bank. There are certainly people who won't be coming by because they're staying home, which is exactly the right thing to do. But if you are well and healthy, we'd love to see you at the blood bank. We are at 2524 Harrison Avenue in Eureka, right in front of St. Joe's. Pull in St. Joe's Lane, we're on the right. We don't do appointments for whole blood donation, just walk in. And like we said, we might put your name on a list and come get you in a few minutes, just to be sure that we don't have too many people in any given space at the same time.
With most of us having more free time these days than we know what to do with, Keat TV wants to hear from you on how you're spending all those extra moments at home. Are there any silver linings in your COVID quarantine? I think that's a song someone should write. We're accepting smartphone videos of a minute or less from you and your family. You can send them to production@keat-tv.org. We'll happily put you on TV and make you famous in exchange for a few happy moments and some insight into how you're all getting along in the age of COVID. This week, Elizabeth Morrison of Eureka and the Anglin family from Lolita both answered our call.
Hi, my name is Elizabeth Morrison.
And I'm Honomijima.
I'm using my extra time of the shelter-in-place order to study Japanese. I'm here in Eureka.
And I'm sheltering in place at home in Kanagawa, Japan. For today's lesson, I chose a paper about the composer Clara Schumann.
A Japanese scholar wrote a paper where she studied every place that Clara went in her long life as a composer, concert pianist, and teacher.
Elizabeth has learned a lot of vocabulary about music, composer or sakyokka, concerto, and concertour.
Because of Clara's career, I can never forget the word for concertour, enso ryoko. And this is my silver lining of the shelter-in-place order. I have more time to study Japanese with my friend Hanomi.
The Anglin family, and during this pandemic, we're all quarantined together, but there's some great silver linings, like starting a garden.
I'm having fun in the sun! Camping outside! Well, camping is domestic!
You see the moves on those? I'm not on camera. No key. If you have any comments or questions, feel free to contact the station at production@keattv.org. All feedback is welcome. Stay tuned, stay informed, and above all, stay safe at home with your family. Together, we will get through this.